All right, guys. Obviously, we're here this morning to talk about RP. Let's start with the simplest question. What is RP and what do people need to know about it?
Yeah, so the pericardium is the fibrous sac around the heart, and when it gets inflamed, that's what's called pericarditis. In the majority of circumstances, we actually don't know what causes pericarditis. It might be a virus or something like that, but you may not even know that you got the virus, or it could be after a procedure or a surgery where they cut into the pericardium for an open heart surgery, for example, as in Henrik's case, then you might get pericarditis that way. The classic symptom is chest pain, and it's a certain type of chest pain that is classically worse laying down, better sitting forward, worse taking breaths in, and can be associated with shortness of breath and fatigue and just really feeling not like yourself and feeling quite ill. Most patients get better with standard therapy, but if the chest pain recurs or does not get better, and it can recur over months or even years, that's what's called recurrent pericarditis.
And then, Henrik, obviously for you, RP is what forced you to retire. Can you talk me through what it was like finding out you had it and how you knew something was wrong?
Yeah, I was coming off open heart surgery. I was in recovery. I started training. I started to feel really good, really strong. I was just weeks away from making my comeback back to the NHL. And one day I just felt massive pain in my chest, my back. I felt sick, tired, um, obviously very concerned. I didn't know exactly what was going on. I thought it was related to the surgery, but I wasn't sure. Um, about 10 days later, I went for a checkup and they diagnosed me with pericarditis. So in that moment, obviously very disappointing and frustrating. Worked so hard to get back to the NHL. But then, I spent the next 3, 4 months just laying low, no activity really, just trying to follow the guidelines I was given by the doctors. Eventually, I did try to make a comeback and start training, but realized pretty quickly it was just too big of a challenge. So I decided to retire from hockey and move on to new things. And I think the biggest thing was just to listen to my body a lot and acknowledge, it's your heart. It's a big part of your body, important part of your body. So to educate myself through discussions with my doctors, how to live with it and how to deal with, potential flare-ups.
When you look back now on what impacted you the most and maybe what stood out symptom wise, is there something that you think people should know? Okay, this is the thing that was the dead giveaway that something was wrong?
Well, the first time it happened, I wasn't sure what was going on. I just felt sick and again, pain, shooting pain through my heart, out in the back. And I just rested for a few days and I started slowly feel a little bit better. Um, but now, after having 4, 5, maybe even 6 flare-ups over the last 4 years, I know what I'm looking for in terms of symptoms. I got to know my body better and again, just to understand what needs to happen if I do have a flare-up. And really, it's just to bring down the heart rate. There's no physical activities. I might go for walks, but that's about it. So that knowledge definitely helped me. But the first time it happened, yes, it's hard to figure out exactly what's going on. You just know that something is off.
And from a medical perspective, how important is it to detect this early and diagnose it early?
Well, I think it's critical. First of all, as Henrik is saying, patients have significant symptoms and it really impacts quality of life. When you talk to patients with RP, they report significantly reduced ability to exercise, to function in day-to-day life and go to the grocery store, play with their kids, because they're in constant pain. And so getting diagnosed early is critical to feel better. But also I would say that if you have unchecked inflammation of the pericardium across years, of course, that can lead to other consequences in the heart. And diagnosed and treated is really critical.
And for both of you, why is this campaign important to you guys and what's the goal that you want to get across?
Well, for me personally, obviously, it had a massive effect on my life, my career. So when this opportunity came about, I felt really strongly about it and help other people dealing with similar experiences, similar situation, And we're not talking about athletes. I mean, yes, that's a portion of it, but another big portion is everyday life. It will have an effect, you know, in terms of not being able to, again, play with your kids or go to social gatherings because you just don't have it in you to do it. So through this campaign, our goal is to educate people, encourage them to talk to their doctor if they do have any issues or feel any pain, to make sure they can get a good game plan in place.
Yeah, and I would just add to that we know that at least 40,000 people in the U.S. suffer from RP, and that's probably an underestimate because we know that it's underdiagnosed and often hard to recognize. About 17 to 20,000 new diagnoses each year. And so I think a major part of the campaign is to raise awareness that this condition exists, that it might be impacting you, especially if you have a known history of pericarditis or autoimmune disease or prior surgeries, things that we know trigger recurrent pericarditis, so that you can get diagnosed and treated earlier. But just to emphasize, you don't have to have one of those things to have RP or to have pericarditis. The majority of cases with classic symptoms, patients actually don't know what trigger it, which again is why I think a campaign like Life Disrupted is so important, because lifedisrupted.com has a lot of great patient-facing resources to help people understand if this might be a condition that they're suffering from, so they can get the healthcare that they need to feel better.
And is that where you would recommend people would go if they want to learn more about the campaign and about RP?
Yes, www.lifedisrupted.com has a lot of great resources. It has Henrik's story on it as well, and patients should definitely check it out. I have great info there.
Awesome. That's all I got for you guys. I know you're on a tight schedule. Henrik, just want to say, huge Rangers fan, so this is awesome to talk to you, and I appreciate you guys making the time.
Thank you. Thanks for having us. Appreciate it.
Of course.
Thanks for having us. Appreciate it.
Thanks, guys.